Okay, we're back. So now I'm going to do scenario 2. He has a, I believe it's a wound on his sternum region, So I'm going to change that and just walk through each step. So first off, you definitely do hand hygiene. And previously, as I did the lung sounds, you'd want to also inspect, palpate, and auscultate, which I failed to mention earlier, so I'm just saying that. Okay, so I perform hand hygiene, I put my gloves on.
Lateral lung assessment.
This is pretty much standard precautions when assessing skin,
The best way that I would
cleaning
be able to do
and
a
dressing
sterile
the
lung
wound.
assessment for my patient, I would have him sit up. I would sit him up as high as possible.
So I'd look at the old dressing, I'd remove it, and depending on where it was, I'd also check CMS, color motion sensitivity, capillary flow, and squeeze out his fingers for about 2 to 3 refills of blood, so get back to his normal skin color. So anyways, I'm going to look at this, I'm going to explain everything that I'm doing to him. What I'll undo is Johnny.
Sit up.
I'll see what we have here.
I'm going to lead him forward.
So I'd also probably want to put down a towel, just to provide
At this
privacy.
time, I'm going to start on his
And,
left side.
I'd also want to put a towel, if he's can move around easier, maybe under his back too, in case anything needs to be done. So I'm going to remove the old dressing.
Then I'm going to move down on this right
Being
side
careful
to
not
the third
to
intercostal space.
cause any skin tears or
Then I'm going to
irritations.
move over to the third intercostal space on his left side. Then I'm going to move over to the fifth intercostal.
So I'd look at the dressing, I'd take these
and
two
then I'll
off.
move over to the right
If they were
side.
stuck, I'd use like some saline to loosen it up, but it's coming up pretty easily.
I
So
will
I would
down
notice that the
to the seventh intercostal space.
he had a scant amount of serosanguinous drainage on the old bandage, and there is no drainage from the wound. So before I do this, I would assess his pain again, 1 to 10. And he stated that he had a pain of 4 on the scale, so I would give him a prescribed analgesic. Wait about 30 minutes, 45 minutes, whenever he feels comfortable for it, around that time, to change the dressing. So this is the dressing. I'd dispose of this in the appropriate facility, required designated receptacle.
On my left side,
So I'll throw it
at
away.
the second intercostal
the trash.
space laterally.
So I take off. First, you look at the wound, and as I stated, what it already is. I also want to count all the each stitches.
Second intercostal space laterally. Then I would move on to my fourth intercostal space laterally.
13 stitches.
And I would move over to my fourth intercostal space laterally.
There's no drainage from the wound. And the surrounding area
I would
is
move down to my sixth intercostal space laterally.
slightly red in color.
And then
So I
I'm
would
going
note that in
to
my
move over
nurse's notes.
to my
So
sixth
I assessed it, take off the old gloves, put new ones on, and
At this time, I'm
also wanting to, while you're doing this whole thing, assessing for size, shape, appearance, color, drainage, etc., etc. So I got the new gloves on, and I'm going to cleanse the wound. So I have a brand new bottle of saline here. If it was a used bottle, it should have a date on it, and I would pour out some of the beginning liquid just to maintain sterility. And since this is a new bottle, it's fine. So I'd open the bottle. I'd have
really like forever.
my sponges here,
Yeah.
and I would put it in the, pour it in with the label up so it doesn't cause any contamination. Pour it in, get a good amount in there, recap it, and I would pick it up. Try to be as sterile as you possibly can. Squeeze off some of the excess.
Okay, so what do I do now? I have to go.
I'd you could do this either 2 or 3 times. I'd do it on the outer region, one swipe down, dispose of this, get a new one. Inner, side closest to me, one swipe down, dispose of it, grab another one, and then go right down the center, dispose of it. And then I would take a dryer piece of gauze, and I'd blot it dry, and dispose of this. So then I'd apply the dressing. We'll say that these are sterile from a sterile package. So place these down, open the new one, place it down. Meanwhile explaining what I'm doing and making sure he's comfortable. So then I would take the other pad, apply this, and secure it. And now I also want to write my initials, the time, which is 12:15 p.m., and the date, 28th, I believe. So I take this, open it up, and try to be as sterile as possible, put it down. Keep it up.
Okay.
Okay, so I dispose of all my stuff. Should have also, when I was assessing it, measured the site too, to make sure that nothing abnormal was going on. And I'd also want to, since this is up at his chest region, I also would have wanted to get his apical pulse too for a full minute, because that was important. So he had an apical pulse of 78, and so yeah. So then I would put this Johnny back on, make sure he's comfortable, get rid of the old towel, cover it back up, raise the rails, lower the bed, make sure he's comfortable, and then I would get rid of my gloves prior to the handrails in the bed, and then I would document my findings, side of the drainage, stitches, comfort, discomfort, how the dressing looked, and how it was, how the patient tolerated it. So that's it.